Hello everyone, this is Andy Perwin and Grace Butler with ACS Business Insurance Services. We're here to bring you your bi-weekly healthcare reform update. We're going to talk about just a few things in regards to some updates, and I don't want to steal Grace's thunder in the beginning here, so Grace is going to take over in regards to a recent change pertaining to
health reform calculator. So there is a little bit of confusion that we've heard some feedback on whether or not someone is considered a large group and whether they will be subject to the health reform mandates. So to put your mind at ease, there are some differences with part-time, seasonal workers, and how that all comes into play in regards to being a full-time worker. So we have access to a calculator that we can absolutely help you figure out if you are subject to the mandate. So put your mind at rest. Give us a call if there's any questions on what is considered full-time equivalent, and we can help you with that, absolutely. We also wanted to talk a little bit about employers who are considering dropping coverage or not offering coverage to their employees because of the mandates and the fines and all that. So Andy and I thought it would be kind of nice to go through why to keep employee coverage and why benefits are important. There's several reasons. Number one would be the cost of turnover, cost of having employees that constant retraining for employees that you're always looking to do, have someone else come in, and employees are going to go to where there are benefits offered.
Yeah, it costs a lot of money in doing that. From an employer's perspective, very expensive to constantly be retraining your employees. One of the other things that's really important to discuss along that same line or along the same subject is the cost of workers' comp typically goes up substantially when small employers don't provide benefits in regards to workers' comp claims. I was meeting the other day with a company that doesn't provide benefits, and I actually asked the owner what his biggest problem was in regards to claims. He goes, we actually got canceled off of our workers' comp, and now we're in a situation where we've got to go to what they refer to as a surplus lines company, and it's costing him substantially more money as a result of not providing benefits and having that huge impact in regards to workers' comp claim. And it's really interesting because when I was talking to him, I said, when do you see your highest claims? And it's usually Monday morning after a long weekend, before noon typically, believe it or not. So that's another reason to really consider keeping your employee benefits, even on a small group basis. Grace is going to go through the next one and we'll keep going.
And I think a real important one is employee loyalty, that employees are definitely going to go to a place where they are offered benefits, and if benefits are reduced at one company, they're going to find another where they will have benefits, and it allows them to be more loyal to their company that they're with.
Yeah, very good one. And the other one is, quite frankly, from a business owner's perspective, the deduction of the dollars that are spent towards those benefits. You're able to deduct 100% of the premium that you pay as an employer towards your employee benefits. And that, again, leads to employee loyalty, which is another big factor. And sometimes we look at it and we go, do I want to provide the benefit to obtain those loyal, long-term, key employees? And that's usually a really good benefit and a really good reason. You're able to deduct 100% of those expenses. With that being said, we've just got a couple more.
And it also allows your employees to stay healthier, and that's a good thing, to have your employees that are healthy and they're going to have less sick days and not going to stay home when they know they have health insurance that they can access instead of staying home or getting everybody else in the office sick, which is awesome.
Very good point. And that's exactly what mine was. You have less sick days. In regards, stealing my thunder now. The loss of employee hours, especially if it's key employees. And when you don't have benefits, typically your employee population will not go to the doctor, get an antibiotic, and be cured in 2 or 3 days. They wait until they're really sick, and then they're out for a week or two. So those are really important factors, and they're just some of the reasons to consider keeping your employee benefit plan. This is Andy Purwin and Grace Butler. Thank you very much for watching our bi-weekly healthcare reform update. We can be reached at acsinsurance.com or at 775-425-3233. Thank you again.
Thank you.
Have a great week.